Hi, my name is Sue Ehler. I'm a physiotherapist and co-owner of the Atlantic Balance and Dizziness Center. Today, I'm going to discuss 3 screening tools you can use to assess for fall risk, including the 4-stage balance test, the timed up and go, and the 30-second chair stand. These screening tools are recommended by the CDC STEADY Initiative for Healthcare Providers. I'm joined today by 2 audiology students from Dalhousie University, Josh Kreppen and Ben Kwai, to help demonstrate. This video is being created as a training tool to help health professionals understand how to use quick screening tools to assess for fall risk. This can help you recognize who is at risk of falls and who might benefit from a referral to a physiotherapist who can conduct a more detailed assessment and provide gait and balance exercises to help reduce fall risk.
The 4-stage balance test is a screening test of static balance. There are 4 standing positions that are timed and get progressively harder to maintain. The first one involves standing with your feet side to side. The patient is asked to stand in each of these positions for 10 seconds. They should stand with a surface in front for safety. The patient can hold their arms out or move their body to help keep their balance, but they should not move their feet. For each position, the clinician says, "Ready, begin," and starts timing for 10 seconds. After 10 seconds, say stop. Patients should not use an assistive device like a cane or walker, and they should keep their eyes open the whole time. You should describe and demonstrate each position to the patient. Then stand next to the patient, hold their arm, and help them assume the correct position. When the patient is steady, they should raise their hands from the support surface and time how long they can maintain the position, but remain ready to assist the patient if they should lose their balance. When the patient is steady, let go and time how long they can maintain the position, but remain ready to assist the patient if they should lose their balance. If the patient can hold a position for 10 seconds without moving their feet or needing support, go on to the next position. If not, stop the test. The second position involves placing the instep of one foot so it is touching the big toe of the other foot. Hold this position for 10 seconds as well. The third test involves the stand-em tand, wherein the patient will place one foot in front of the other, heel touching toe, and hold this position for 10 seconds. The final position involves standing on one foot, again for 10 seconds. That concludes the 4-stage balance test. Next, we are going to review the timed up and go test, which is a quick test that assesses fall risk in the elderly population. In this test, the person is timed while they stand up from a chair, walk to a target 3 meters away, turn around, walk back, and then sit back down. The time it takes someone to complete this task has been correlated with fall risk. To conduct the test, you will need a standard armchair, a stopwatch, and a place marker 3 meters in front of your chair. To start, have the person you are testing sitting in the chair. If they require a walking aid, make sure it is accessible and record what they used during the test in your report. Next, explain to them what they need to do. The person getting tested is allowed 1 practice round before they are timed. Normative data differs according to special patient populations tested. For community-dwelling adults, a time of over 12 seconds would indicate a risk of falls. Make sure to observe the person's postural stability, gait, stride length, and sway. Record if you see a slow tentative pace, loss of balance, short strides, little or no arm swing, shuffling, not using an assistive device properly, or steadying themselves on a wall. Finally, we are going to review the 30-second chair stand screening tool, also known as the 30-second sit-to-stand test, which tests for leg strength and endurance. You will need a standard chair with a straight back and no armrests, about 17 inches high, as well as a stopwatch. You will want to place the chair against a wall so that the chair cannot slide backwards. The patient is instructed to sit in the middle of the chair, to place their hands on the opposite shoulder crossed at the wrists, to keep their feet flat on the floor, to keep their back straight, and to keep their arms against their chest. On go, the patient is instructed to rise to a full standing position, Then sit back down again, repeating this action for 30 seconds. The clinician counts the number of times the patient comes to a full standing position in 30 seconds. If 30 seconds is reached when the patient is halfway to a standing position, count it as a stand. If the patient cannot stand or must use their arms to stand, stop the test and record 0 for the score. Not being able to stand from a chair without using one's arms to push up indicates a high risk for falls. The clinician should stand close enough to catch the patient if they lose their balance. If the patient gets tired, they may rest, but the timer should keep going. Norms are based on age and sex at birth. For people aged 60 to 64, men should be able to come to a full standing position 14 or more times in 30 seconds, and women 12 or more times. If the patient falls below these normative values, it indicates lower body weakness, which is a risk factor for falling.